In today's video, we're going to look at what treatments the research shows works best for Achilles tendonitis or tendinopathy. And we'll also look at, if it doesn't work for you, because it doesn't work for everybody, what other treatment options you can add in. Then we'll look at what the research shows is a waste of time and money because they simply don't work. And lastly, what treatments you actually want to avoid because they may actually cause more harm than do good. Now, this is going to be a long video, so what I'll do is I'll put chapters in the video so that you can have a look and jump to the sections that's relevant to you. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment via video call for all your Achilles injuries. Have a look at the description of this video if you want a link to our website. So what treatment is the research showing works best for Achilles tendonitis or tendinopathy? Well, it's a combination of things. It's a combination of relative rest plus a rehab plan, so that means exercises, plus addressing any fears or anxiety. Now, let's unpack this in more detail to see what each of these sections really mean and why they may be needed. So what is relative rest and why is that needed? If we first look at complete rest, so complete rest would mean that you don't do any activity or very little. So you usually would run and you would walk a lot, but now you're just trying to stay in bed because you want your Achilles to heal. Now, what the research is showing is that complete rest, and especially putting it in a boot or something where it doesn't move, is actually not that good for a tendon injury like Achilles tendonitis. And the reason being is you do need the improved circulation that comes with movement. And if you rest for too long that you don't do anything, your tendon actually loses more strength. So what you want to do is you do want to reduce your activity temporarily, because remember, when your tendon has a tendonitis or tendinopathy, you lose some of the strength in the tendon and it becomes really sensitive. So it can't cope with the amount of exercise or just walking you would normally do. And to allow it to recover, you have to reduce your exercise and your normal activities like walking or stair climbing just to a level that it can currently cope with. Now, if your tendon is super sensitive, it may not be much, but just moving around the house, especially wearing specific shoes and things, I'll talk about that later, may be enough to help improve the circulation to allow it to heal. So complete rest where you don't do nothing or anything is not advised, although it may be useful for 1 or 2 days, not for longer than that. But relative rest is the key to staying active and getting going. And I've made a full video about that in a lot more detail. So have a look at the description of this one for a link to that video. So the second important part to a successful treatment plan is adding in exercises. Now, why do we need exercises? Well, there are 3 reasons why you need exercises. The first is they can actually help reduce pain. If you choose your exercises well and they are pitched at the right level for you, they can help improve the circulation and decrease your pain. The second is that they can strengthen the tendon back up. So remember, when you have Achilles tendonitis, especially if you have it for a long period of time, more than a few weeks, the tendon starts to lose a little bit of its strength. Now, strength training exercises, again, they've got to be pitched at the right level for you, can stimulate the tendon to produce new collagen fibers and replace the old injured ones. So that's a good way of strengthening the tendon. And then thirdly, if you're doing sports or activities that really work the body hard, doing exercises that strengthens the rest of your body will reduce the load on the Achilles tendon. So for instance, if we think of what the tendon does, is it helps propel you forward with your calf muscles. Now, if your glutes, for instance, isn't as strong as they should be, your calf will have to do more work, so your Achilles tendon will get loaded more. So it's really worth, if you're a sports person, to look at what the rest of the body is up to. Now, you may be listening to this and think, I've tried exercise before, but it usually just makes it worse. Or you know what, I've not seen any results. What the research is also showing is that the exercise plan has to be tailored to the individual. So every person with Achilles tendonitis or tendinopathy, their case will be specific to them. So every person has a different strength in the tendon, different strength overall, different goals they want to get back to, and their tendons will have a different level of sensitivity. And all of this has to be taken into consideration. So the most common exercise used for Achilles rehab is the heel raise or the calf raise exercise where you go up and down your toes. But there are so many different ways that you can do it in. You can do it on double legs. You can do it to floor level, over the side of a step, on a single leg, with extra weight. Isometrics where you just hold the position, or 2 up, 1 down, or up and down. There are literally so many ways to do that. And depending on how you do it, it will place a different load on your tendon. So the most common mistakes we see is that people are either given exercises that are too hard for them, so it just flares the tendon up, keeps it sensitive, or they are asked to do them too often, so the tendon never gets time to recover, or it is simply that the exercises is not in the correct position for them. Often people will focus a lot on doing Achilles tendon stretches because a stretch can feel quite satisfying while you're doing it. You can feel it really getting into the area that's the problem, and it feels relieving at the time. The problem is that tendons that's injured often don't react well to stretching. So it feels really good to do it in the moment, but then several hours later, the tendon becomes more painful. And what we found is in cases where people's tendon pain doesn't want to calm down, if we just ask them to stop stretching the tendon and avoid positions where they go over the side of a step or just doing a calf stretch, that pain really can start calming down. And this is even more important if you have insertional Achilles tendonitis, because that is usually a lot more sensitive to being stretched. Now, I have made a super detailed video about exercises and how to progress them and what you want to be thinking about for different scenarios, because that is a full video in itself. And I've put a link to that video in the description of this one if you want more information about that. Then the third treatment that the research shows should really be added into a treatment plan is having a look at people's stress and anxiety levels. Now, this is not just related to your injury. This can be stress from work, life, social life, anything like that. And you may be thinking, what is this about now? What does stress in my life have to do with my injury? Well, you've got to remember, when you stress, the body produces stress hormones, cortisol and things like that. And the brain interprets the hormones in the blood, but it can't understand what hormones are coming from an injury, what hormones are coming from a stressful situation. It doesn't separate that out. So it just sees stress hormones and it goes, oh, if we've got stress, we sound the alarm system. And at the moment, we've got an alarm system creating pain. So we'll just amplify that pain. So what the research is showing is that some of the time, people will feel more pain than what they should, because they look at a scan and they go, well, you don't have much injury in there. Why do you have such excessive pain? And then they find that the stress in the life is actually amplifying the pain because it makes the brain think that you're under a bigger threat than what you are. Another thing is that they found in some people, the injury has actually healed, but the pain continues. And the same thing goes with that. Nobody has told the subconscious that the stress hormones it's picking up is through other life stress. It thinks it's still related to the injury. So it keeps the pain going because it wants you to be on alert to protect your foot still. So if your pain is continuing, despite you actually progressing well with your rehab and doing all the right things, and you feel that there may be stress or anxiety contributing to it, it's definitely worth looking at those factors. Alison has made more videos where she goes into a lot more detail about this. And again, I'll put that in the description of this video for you if that's something that interests you. Next, we're going to look at what treatments you can use to reduce the pain when you have Achilles tendonitis. Now, these treatments, if you use only them and don't combine them with anything else, will not necessarily be a total cure for your Achilles tendonitis. And it may come back if you don't do a rehab plan because you need something to strengthen the tendon. But they are very good at reducing the pain. Now, you may be wondering, well, what's the use if they only reduce pain? Well, if your tendon's too painful to start rehab, then it's blocking your progress. Also, having pain can make it really miserable to go through the day. So it's worth trying these things to see if you can become more comfortable. The first one that we find really works well, especially for people who have insertional Achilles tendonitis, but it also works for mid-portion, is to use heel lift inserts inside the shoe, or simply wear a shoe with a bit of a heel on it. Now, how does this work? If we walk with our feet flat, if you imagine this is the foot, this is the calf, Achilles tendon. The flatter the foot is on the floor, the more the tendon is stretched. Now, I've just mentioned before that a tendon that's injured doesn't like to be stretched much. So if you place a heel under or lift your heel a bit, either through a heel raise or just wearing a shoe like a running shoe that has a bit of a heel to it, it reduces the strain on the tendon. And especially when you've got insertional Achilles tendonitis, that can really reduce the compression as well in that area, and it can make it more comfortable. So the first thing to test is just check if wearing a different type of shoe helps. If you've been wearing flat shoes or going around in bare feet, try a shoe with a bit of a heel. If that doesn't work well on its own, get something off Amazon. They're really cheap, just little heel raisers, and I'll put a link to those heel raisers in the description of this video that you can see what I mean. Then gentle massage may be useful. Now, this should not be confused with cross frictions on the Achilles tendon. So massage is brilliant at reducing pain if it's done at a comfortable level. If you're going to take the tendon and do cross frictions where you really grind it and hard friction, you're likely just going to irritate it more. And I've had patients come to me saying, oh, I saw on the internet you had to really do hard cross frictions to get the tendon to heal, and now it's much worse. So cross friction, no, but gentle massage of the calf muscles as well as the tendon may make it feel more comfortable. So it's something to try if your calves are feeling really, really uncomfortable. Same thing goes for dry needling. If you have really tight calf muscles or uncomfortable muscles, doing dry needling can make a difference. So dry needling is where they use the same needles as acupuncture needles, but insert them into the muscles. It's important to understand that this is not a cure. It only reduces the muscle tension for a bit, but because the tendon is still irritated, the tension will come back. So you have to do exercises alongside that to get everything to feel better over a longer period of time. What about taping the Achilles or calf muscle? So that's applying either kinesio tape or rigid tape. Now, people often claim that tape can protect the Achilles tendon. It's simply not strong enough to do that. You're better off in a shoe with a bit of a heel raise or putting a heel lift inside there to not allow it to stretch that much. Because what the research shows is tape holds the position for about a few minutes and then it relaxes. But what it can do is it can reduce your pain temporarily while the tape is on there. So again, if it feels more comfortable while you've got the tape on there, go for it. If not, then leave it out. Low-level laser therapy uses light therapy to treat Achilles tendonitis. Now, there are claims that it can speed up the healing process. For the moment, the research is showing that actually that is likely not the case, but it may help reduce your pain. Alison has done a full video on that, so if you want more information about that, have a look at the link in the description. Then shockwave is something we often get asked about. For the moment, the research is showing sometimes it works, sometimes it doesn't work. In my own experience, shockwave works best for insertional Achilles tendonitis, but not during the early stages. So if your tendonitis has flared up recently, often shockwave either doesn't make a difference or it can make it more sensitive. It's more useful for cases that's been going on for several weeks, perhaps even months, and you just feel you want to kickstart your rehab process and get the pain under control. Then it may be of use. So with that, I would definitely say try rehab first. If you feel you're a bit stuck, it's something to consider, but not during the first few weeks. Ice and heat are things we often get asked about. Now, ice and heat will not speed up your healing, but it may make you feel more comfortable or reduce your pain temporarily. What I will say is it's not about leaving the ice on there for hours at a time. It's usually maximum 10 minutes. Take it off for 10 minutes, apply for another 10 minutes, but 10 minutes may be even too long. So, and also heating tissue for a long period of time is also not a good idea. You want short stints of it and you want it to be mildly, so cold but not super, super cold, and warm but comfortably warm. If you overheat or overcool tissue, you can actually cause more damage. So you can use it for pain, but not leave it the whole day on. And I've made a video about that one as well. TENS machines. So TENS machines is where you get electrical stimulation that just goes over the skin. It can be useful for reducing pain, but it doesn't bring about healing. It is something to try. If you have a TENS machine, I wouldn't go out and buy one. There are other things I would try rather. Now, losing weight is something that can be useful. And I know it's difficult to lose weight, but carrying an extra few pounds actually has a profound effect on the body. And you may think, oh yeah, it puts more load through the Achilles tendon. But actually it's more significant than that. Yes, of course, if you are a little bit overweight, then your Achilles will have to work harder. But if you carry extra weight, especially if the fat is around your belly, that has been shown to increase the inflammation levels in your body. So that can actually keep the pain going for longer, and it can have a long-term effect on all your tissues. So if you have a bit of extra weight to lose, it may be worth trying to do that. Now, high volume injections is something that could be useful for pain, but again, it's worth noting this only works for pain, and it's not been shown to stimulate healing. So if you do go for that, you have to still use a rehab plan as well. Then something that's gained popularity over the last few years is 10x treatment, where they do minimal invasive surgery and they go in and remove the injured part of the tendon via ultrasound waves. Now, this helps for pain, and the pain relief can sometimes be immediate. But what we don't know from the research is what the long-term effect is. And you've got to remember that we're just removing the part of the injured tissue. We don't know if it's regenerating it yet. The research hasn't really shown that bit yet for us, that it actually brings about healing. And it doesn't do anything to change the strength of the tendon. So you do have to still follow it up with a graded strength training plan. If you're only going to go, oh, I have no pain now, so now I can go back into sports, your tendon may not be strong enough for it, especially if you've had tendonitis or tendinopathy for a long period of time. And the pain will just return, or you may injure a different part of the tendon. So if you are going to go for 10x treatment, you have to follow it up with rehab from your physio afterwards. There are 2 treatments that's been shown that may promote healing, but we don't have very strong evidence for that yet. So we can't yet say that this has to be always used, because the evidence is based on only a couple of studies and some of the research is contradictory. So we need large studies to show that this is not just a mistake caused by luck or a result caused by luck, but that it actually makes a difference. So the 2 treatments are PRP injections, where they take your own blood and spin it and get your platelet-rich plasma and inject that into your tendon. Now, we know that it can help with pain relief, but the thought is also that it then stimulates that part of the tendon to regenerate. The research on PRP at the moment is a bit hit and miss. Some studies shows it works, other studies shows it doesn't really have an effect. So what I will say is, if you're not making that much progress with your rehab and you don't see progress week on week or month on month, PRP is something I would consider, but it won't be the first thing I definitely do. Then the second one is supplements. And the supplements that they have tested so far is a mix of vitamin C and hydrolyzed collagen. Now, collagen is the main building block of tendons. And what they've done is they've used it, that they've got people to take it, and then 30 minutes before they do their strength training exercises. And what they found is that it may be that the tendon actually gets a better benefit from the strength training exercises if you do that, because it now has the building blocks in there. Now, this makes sense when we think about it, but this doesn't mean that this is how the body uses it. So we need stronger research to confirm this, but there are a couple of studies that's shown that this method may help. If you're interested in this, I've made a whole video about what they used in those studies, and you can have a look at, I'll also put some links to the type of supplements that they've used in there. But yeah, decide for yourself with that. The research is not that strong yet. Then there are some treatments that are useful for specific cases, but not for all. And these treatments should only be used if you've been assessed and found that actually you need this thing. So the first is hormone replacement therapy. When we go through the menopause or perimenopause, females have a drop in estrogen levels. Now, estrogen is the hormone that's in charge of producing new collagen fibers and making them stronger. And collagen fibers are the main building blocks of tendons. So what happens is, if you're in the perimenopause or the menopause, your tendons struggle to produce the new fibers to repair themselves. And there is some research showing that if you take HRT or hormone replacement therapy, it may actually help your recovery from Achilles tendonitis or tendinopathy. Now, Alison has made a detailed video about this and how this works. So if you're interested in that, I've put links to that video and another one about the menopause in the description. Arch support insoles. Now, we've spoken about the ones that lift the heel up. That's useful for most people. But then arch support insoles are ones that stop you from pronating too much. So if your physio or podiatrist have assessed your foot and found that actually your foot turns in more than what it should do, then that can place extra strain on your tendon. And if that's the case, you may benefit from orthotics to stop that overpronation. Putting your foot in a boot, so immobilization in a boot. Now, I've spoken earlier about how complete rest where you don't do anything is not useful. It's better to stay active. But in some cases where the tendon is super, super painful and it just doesn't want to allow you to do anything, putting the foot in a boot where it doesn't move and is really protected for 2 or 3 days can be useful. But the key here is it's not about sticking it in a boot for weeks on end. If you do it for more than a week, you're starting to risk that the tendon is actually losing some of its strength. And what we see in practice is these patients will book an appointment and say, I've been in a boot for 6 weeks. It's not feeling that much better, or it is feeling much better, but as soon as the boot comes off, the pain comes back. And it's because you've now lost more strength and now you want the tendon to actually carry the weight from walking. So if a boot is prescribed, it should only be for a few days and then it should be followed up with rehab. In most cases, we find that wearing the right type of shoe and getting a heel lift insert in your shoe is a much better approach than putting a foot in a boot for several weeks. Anti-inflammatory medication. Now, when we look at the injury process that's involved in Achilles tendonitis or tendinopathy, there's very little inflammation involved. Some cases that is caused by inflammatory conditions like gout or arthritis, they can benefit from anti-inflammatories. If you have an overuse one, so you've done too much sport or too much walking, or you just wore flat shoes that really flared your Achilles up, in those cases, actually there's not a lot of inflammation. So taking anti-inflammatories doesn't make much difference for that. Also, if you have the overuse type and you use anti-inflammatories for a prolonged period while doing your rehab, the research shows that you may not actually get the full benefit from the rehab. But if you have tendonitis caused by either antibiotics as well, a gout, or you have a bursitis, anti-inflammatories may be useful. I've made a full video about this where I discuss this in a lot more detail. So if you're interested in that, have a look at that video. Description has the link. Then surgery is an option for some people, but the current recommendation from the surgeons is that you should have tried a rehab plan that's catered to your needs and at the right level for you for at least 12 months before you consider surgery. Now, why 12 months? Well, it's because tendons take a very long time to recover. If we think of a muscle tear, muscles have lots of blood circulation and the muscle fibers and cells regenerate really quickly. So most muscle tears gets better within 6 weeks. If it's a severe one, maybe 12 weeks, and that's it. Tendons, on the other hand, the shortest recovery period is 12 weeks. And it's more often 6 to 9 months, and in some cases more than 12 months. Now, I've made a full video about discussing what influences recovery times for tendons as well. So have a look at that if that's something that interests you. So if you have tried your rehab for 12 months and all the other treatment options we've spoken about before, injections and shockwave and those things, and you're just not making progress, then surgery where they go in and remove the injured part may be an option. But try the other avenues first. What treatments are a waste of time and money? So the first is ankle braces. So ankle brace is typically what you'll wear for an ankle sprain. And what it does is it keeps the foot in a dorsiflex position and it stops it from rolling in or out too much. Now, the Achilles tendon is not really affected much by in and out movement. It is more affected by up and down movement. So ankle braces doesn't work for tendonitis, and it can sometimes irritate it more because it keeps it in that specific position. So leave them out, they're not needed. Second one is night splints. Now, night splints are useful for plantar fasciitis, which is a painful condition you get under the foot, but they do not work for Achilles tendonitis, and they often irritate the tendons further. Alison has made a full video where she explains this, but a night splint is definitely not needed, and I know people can think it's needed because it's first thing in the morning that your foot feels so uncomfortable, but actually gentle movement will make that discomfort go away more quickly rather than wearing a night splint. So have a look at that video if you want more information about that. Then thirdly is ultrasound. And ultrasound is something that physios often use on it because they all have an ultrasound machine in their clinic. But ultrasound has so far not been shown to affect tendon healing in humans. And as far as the research is concerned, at the moment it's a waste. The recommendation is that actually it's a waste of time and money and should not be added in for treatment for tendonitis. Now we get to treatments that can actually make your tendonitis worse and reduce your tendon strength over time. The first one and most important one of those is corticosteroid injections or tablets. Now, corticosteroid tablets or injections are often prescribed because they're so good at reducing pain. So people will tell you that, yeah, after taking the tablets, my foot feels much, much better. The problem is they also interfere with tendon healing. So they reduce your pain, but now they stop your tendon from producing as many collagen fibers, and it's more difficult for the tendon to strengthen itself. So what the research is showing is that the long-term outcome is actually quite poor, and it may increase your risk of tearing your tendon. So for some reason, there are certain regions where doctors tend to prescribe corticosteroid tablets, even just a short course, because they know it's going to make the patient happy and take the pain down. But it's really better not to use that and ask for other options to reduce your pain. The second one that goes hand in hand with this, because typically we'll see a patient is stuck in a boot for 6 weeks and given corticosteroid tablets. Now that's a double whammy. Being stuck in a boot for more than a few days, like I spoke about before, is really not good for your tendon because it reduces your strength even more. So you may feel really comfortable in there, especially with the tablets as well, but then you come out of the boot and your pain just returns. And typically what I then see is the doctor will go, oh no, your tendon's not responded to this treatment, so now you need surgery. Now that is absolute nonsense. So if you feel that that is what's been prescribed to you, you need to really go to somebody who can give you proper advice about load management and exercise and other ways to reduce your pain. Then I've spoken a little bit about this as well, is cross-friction massage. So whilst gentle massage can help reduce your pain and make you feel more comfortable, doing really strong massage on the tendon that really rubs the tendon and doing cross frictions often just irritates the tendon, especially if it's in the early stages. And if you have a bursitis, that will likely make it all flare up even more. So gentle massage, yes. Cross friction, no. Then the final treatment to avoid is prolonged periods of rest. Now we've spoken about this as well, but putting yourself in the bed and not trying to use your foot at all is usually counterproductive because one, it makes it feel more stiff and uncomfortable, and two, you're reducing the strength of your tendon. So whilst rest for a day or two to really allow it to calm down a bit is brilliant, you have to just start doing some gentle movement and gently get going within your limits of pain to allow your healing to take place. Brilliant. Hope you found that useful. Now, remember, all the links to the videos and products I've spoken about is in the description of this video if you want to know more. Let me know if you've got any questions, and if you need more help with your Achilles injury, you're welcome to consult one of the team via video call. The link to our website is in the description of this video. Take care.